The most common incision is probably one that people are familiar with through C-sections. That's probably the most common incision to make to do a hysterectomy or do a myomectomy. Maybe a little longer than the C-section incision, but in the same area. Depending on how big the pathology is, the incisions can be up and down, and no one wants one of those. At least the low C-section incision is sort of hid at the underwear line, but no one really wants an up and down incision, which we refer to as a vertical incision. So occasionally the pathology gets that big that a surgeon may think that's in your best interest. Now, the incisions from a robotic surgery can be placed at particular levels. And I've actually had patients draw out where their bathing suits go, their bikinis go, and actually make the punctures within those lines. So it's very controllable that way. There's a small incision at the belly button, so that one's kind of hidden. And then there's a couple other staggered incisions with an emphasis on trying to achieve a good cosmetic result. But when you think about it, even if you had a few pokes up high, that's much better than the recovery from a low vertical or fan and steel incision. I mean, there's just really no comparison in terms of the recovery.